I'm currently looking at radio's hybrid future, basically how broadcasters can work with partners to improve life in a community, particularly in East and West Africa. Which is why I found the Mobile Health Alliance stands at this year's Mobile World Congress in Barcelona to be so interesting. Several individual initiatives are now coming together, and that's essential if the sector's to grow.
They're individual applications for individual purposes. For example, disease collection, disease tracking, interviewing patients, providing frequently asked questions to community health workers. All individual applications, but they haven't been tied together into a system, and that system then tied into the underlying health record system of the country. So there's sort of kind of point source solutions have been come up with, but not an integrated solution. The cost of erecting clinics is prohibitive. Everywhere is prohibitive. So what this allows governments to do is to extend healthcare way out beyond the physical reach, the physical limitations we've had so far. Second, when you have to come in to walk into a village or go to a hospital, you may have to take a day or two off from work. So there's a huge amount of cost involved to the individuals. Or if the government in turn has to send somebody out to take care of you, to take a test, there's a huge cost. So it's a much more efficient way of delivering a lot of healthcare. Obviously, you can't deliver all healthcare over a wireless phone, but you can do a lot.
Well, so Sproxel has solved the issue of counterfeit medications or counterfeit pharmaceuticals. What we do is we provide these types of tags, sorry, one moment, here, and we attach them to a pharmaceutical product. And what a customer does is when they buy the product, a consumer, they then can scratch off the tag with a coin or something of that sort to expose underneath it a numeric code, just like this here. They have a little numeric code. And then what they do is they text message that to us, and they get a response whether or not the product is authentic or genuine, or whether it's fake and it's a counterfeit. And so the idea is that this solution, which is, by the way, free to consumers to use, and that's very important, enables a consumer to feel confident that the product they're buying, the pharmaceutical they're buying, is actually an authentic pharmaceutical, a genuine pharmaceutical.
To what extent is it a problem now in Nigeria?
It's a huge problem in Nigeria. So depending on which report you read, for example, WHO, the World Health Organization, estimates that as much as 30% of pharmaceuticals sold in the developing nations are counterfeit and are not real. So it's a tremendous problem.
Okay, so what they're buying is a piece of chalk?
Well, it depends, actually. In some cases, what they're buying is something that's completely useless, like a piece of chalk, or most common actually is cornstarch. But in other cases, they're actually purchasing products that are toxic or could be poisonous to them. And that's even worse, obviously, because not only are they buying something that's not authentic, but they're buying something that actually is detrimental to them. It can hurt them. So that's really a problem we're trying to address.
And how far have you got?
Well, right now we're in Nigerian market with this product, as I showed you here. This is a diabetes medication, and it's a Merck product. It's distributed by a company called Biofem in Nigeria. And they're using our solution right now in Nigeria to help solve this problem.
The beginning of all of this is good education, good healthcare education in staying healthy. You know, too often we think of health as treating people who are sick as opposed to keeping people from getting sick. And so broadcasters can play a very large role in that, and carriers can as well, with public information programs about how to live, how to eat, how to engage in sex safely. There's a whole series of those issues that need to be addressed.
And presumably also dispelling rumors, because rumors kill.
Well, rumors, there's lots of false information. If a disease starts off, one of the great advantages of mHealth is you can track disease emergence much more quickly and much more accurately. But then once you find a rumor, adopting all of the routes of communication out to the public in a coordinated way is what really makes lots of sense. And certainly public broadcasting is a piece of that.